Good morning, Dr. Thompson.
Good morning, Mr. Walker. What brings you in today?
I've been feeling quite unwell for a while now. I've been experiencing a range of symptoms that are starting to interfere with my daily life, especially my work.
I see. Could you describe these symptoms for me?
Sure. It started with fatigue and headaches about 2 months ago. Then I noticed joint pain, especially in my knees and elbows. More recently, I've been having trouble concentrating and some memory issues. My sleep is also disturbed.
That sounds quite concerning. Have you noticed any rashes or unusual skin changes?
Yes, actually. I had a rash on my thigh that looked like a bullseye. It appeared about 3 weeks after a camping trip in upstate New York.
That's very indicative. Did you get a tick bite during your trip?
I didn't notice one, but I guess it's possible.
Have you had any other significant health issues in the past? Any chronic conditions?
Not really. I've generally been healthy. Just the usual colds and flu, nothing serious.
How about your family history? Any known conditions that run in your family?
My father had rheumatoid arthritis, and my mother has hypertension.
Are you currently taking any medications?
Just some over-the-counter pain relievers for the joint pain. I also take a multivitamin daily.
Any known allergies?
I'm allergic to penicillin.
Based on what you've described, it sounds like you might have Lyme disease. The rash you mentioned is called erythema migrans, which is quite characteristic. Have you heard about Lyme disease?
Yes, a bit. I know it's related to tick bites and can cause a range of symptoms, but that's about it.
Exactly. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted through the bite of infected black-legged ticks. Your symptoms align well with Lyme disease, especially considering your travel history and the rash.
What should we do next?
We'll need to confirm the diagnosis with a few tests. I'll order an ELISA test to detect antibodies to Borrelia burgdorferi. If that's positive or equivocal, we'll follow up with a Western blot test to confirm.
How accurate are these tests?
They are generally reliable, especially when used together. The ELISA test is sensitive and the Western blot adds specificity.
And if it's confirmed that I have Lyme disease, what's the treatment?
The standard treatment is a course of antibiotics. Since you're allergic to penicillin, we likely use doxycycline. It's effective for most cases of Lyme disease, particularly in the early stages.
How long would I need to take the antibiotics?
Typically, the course lasts for about 2 or 4 weeks. We'll monitor your symptoms closely to ensure the treatment is effective.
What if I don't get better with the antibiotics?
Most patients respond well to antibiotics, but some can have persistent symptoms. This is sometimes referred to as post-treatment Lyme disease syndrome. If you continue to experience symptoms, we'll need to reassess and possibly conduct further tests.
That sounds reassuring. What can I do in the meantime to manage my symptoms?
Rest is important. Continue taking over-the-counter pain relief as needed, but avoid any medications that might interact with the antibiotics. Also, try to maintain a healthy diet and stay hydrated.
When should I come back for a follow-up?
Let's schedule a follow-up appointment for 2 weeks after you start the antibiotics. If your symptoms persist or worsen before then, contact my office immediately.
Thank you, Dr. Thompson. This has been very informative.
You are welcome, Mr. Walker. We'll get those tests done right away, and we'll proceed based on the results. Take care, and I'll see you soon.
Thanks, Doctor. See you soon.